protesting racism in the middle of a pandemic. The stakes are dangerously high, and demonstrator Elena Sanera feels it.
Me personally, it's scary. I live with my grandmother, and I'm sanitizing up to my elbows because I don't want her to be exposed to something that I might bring home.
Health officials have made it clear the coronavirus thrives in large gatherings, but not all doctors view this moment in time the same way.
You can't help but see any crowd anywhere in the world today and not have concern about COVID-19 in that group.
It's just far more complicated than saying this is the wrong decision because it will increase the risk of spread of COVID-19.
Some demonstrators are taking precautions. In cities around the world, people are wearing masks. They're offering up hand sanitizer, handing out gloves, and where possible, some are trying to maintain physical distance, while others are going even farther to raise their voices from a safe distance. After her shift, this doctor broke curfew in New York City to protest.
I think it's really important to do what is right and do it at any hour of the day peacefully.
The responsibility of keeping safe is not just on the protesters, it's also on the police.
In a pandemic, some are questioning the wisdom of using tear gas and pepper spray, chemicals that leave people sneezing and coughing droplets that could spread the coronavirus.
Hand out the masks to the protesters, hand out sanitizer to the protesters. Make a point that as officers of public safety, that you are concerned about keeping people safe as well.
Protecting protesters who've already decided they're willing to risk their own health to help save those around them. Christine Birak, CBC News, Toronto.